So now's the point. You should feel the inflection, right? We've done a lot of discussion about how do we think about community? What does the community think of us? What are some of the fundamental pedagogical issues that are common to all of our professions? Now we're going to begin talking specifically about spread and scale. And it falls to me to summarize all of implementation science over 40 years in 10 minutes, okay? So the first point is by way of terminology. And one of the things we learned in the group is that different disciplines use different terms for this. And for the purposes of the next 24 hours, let us say that what we mean by spread is a spread across professions or a geographic spread. Whereas scaling the implication is numbers and size as we go forward. And there's a lot of overlap depending on your discipline, but let's be thinking about multiple dimensions of spread or scale. The second issue is, what are we about and where does health professions education now take place? This, and most of you know this is a classic article by Carr White when he was in the early 60s. And what he did was to set out the best available empiric evidence about what happens to patients. Given that it was in the early 60s, there wasn't the emphasis on prevention and its ecology of medical care as opposed to healthcare or health. But of 1,000 people, 750 will have a symptom, 250 will see a physician, 8 will go into the hospital, 9 will go into the hospital, and 1 will go into a tertiary care center. And the question that he asked is, why are we doing all of our education down in the right the box at that corner? And that was the birth of a lot of the educational revolution of the 60s. Now you might ask, well, has this changed? You know, healthcare has changed a lot in the last 50 years, and Larry Green redid this about 10 years ago, and there's virtually no change in these numbers. The issue is still here, and what I'd suggest to you is our question, all of our professions, is how do we get our experience out of the right lower box and broader into that. So the second point I'd make, and you know, it used to be called diffusion theory or diffusion science, and now it's implementation science, and that's controversial. But the question is, there is a natural, empirically derived kind of progression of change. If you look at a particular behavior, how does it progress through a set of providers? This data comes from the early 60s again, and it's the adoption of an antibiotic prescription. And as you can see, there's an emphasis on innovators, early adopters, and so on. And most people would say that somewhere around here is the early majority, is the tipping point as we go forward. As some of you are familiar, I've been running a program in North Carolina that has grown from 18 practices. It's kind of a practice transformation project up to about 1,100 practices. And so we think that somewhere in this range is when you can begin to have a tipping point in terms of quality and a variety of other things. My question for you is, where are we with innovations in health professions and IPE and others? To me, and it's probably worth a discussion, but to me, we're somewhere in here, sort of going forward. And then the question becomes, how do you move it forward? And then, again, summarizing a lot of research over many years in one slide, and apologies for the slide. But I think there's several bodies of work. First of all, is the characteristics of the specific innovation are really important. If it's more complex, it's slower to diffuse. Likewise, all innovations bring benefits and costs not only to the individuals and the learners in the institutions, but kind of primary and secondary. There's costs at lots of different levels. In the 80s began a kind of very appropriate correction of that, which is to say, well, it may or may not be those things, but the key thing is what the adopters think of it. The key thing is the impression of what the innovation is. So the question for us is, all right, what do the institutions we're dealing with and the professions we're dealing with think of IPE, for example, or others? And the final piece, and I think all of us understand this, and this is why companies try to hire this out, is the timing and the framing of the introduction of the innovation are critical. How you describe it, how you maneuver it, how you develop the champions of it is obviously something that marketers have been thinking about for a very long time, and I think increasingly in healthcare we're beginning to do that. My question for us as we think about over the next day and a half, how do we get and begin thinking about this as we try to spread these new ideas, whether it be IPE, the use of simulations, different kinds of community experience, how do you spread it? How do you scale it? And sort of close it for there. We're right at 2:45. You've got a 30-minute break, and we'll come back beginning the kind of tools of spread and a discussion of some additional models tomorrow morning. So thank you all very much for great participation.